Well, hi everybody. This is Dr. Schroder with this week's slightly belated video introduction to week number 2 of our course in patient and staff education. I hope everybody had a very nice holiday weekend. I was having a nice weekend, but sometimes when I'm down in Mexico, my bandwidth isn't really what it needs to be in order to upload a video, and that was the case this weekend. So therefore I delayed the actual taping of this video until Tuesday, so you're getting this a little bit later than usual, but really, it doesn't really matter too much. Week number 1 was fairly straightforward. Really, most of the time in class, certainly most of my time, was spent interacting with you all in the introductions forum, and I see that we have a very nice array of students, all of you from a variety and varied background. Some of you, it's good to be reacquainted with you. I've had some of you in some previous courses. Um, and also it's nice to see that we have nurses that are interspersed a little bit around, well, at least in a few different states. So that's kind of nice because in week number 2, well, first of all, in week number 1, just to recap week number 1, really the discussion question was really kind of just a foundational entree into this class, which was discussing the roles that that staff educators and staff and nurse patient educators rather take in organizations and what the educational requirements are. Pretty much the educational requirements as discussed in the class was most staff educators are a absolute minimum of a bachelor's degree, although in most organizations and certainly in acute care hospitals that would normally be a master's degree in nursing, possibly a nurse practitioner or a clinical nurse specialist. And the role of the educators is quite varied, more so than nursing educators that work strictly in a college setting or in a university setting. What we'll be discussing as we move through the course is how the role of the nurse educator is very much integral with the strategic plan and with the mission of the organization or the mission of the hospital. So therefore, leadership is very important. And nurse educators and staff educators are, in almost every case, an integral part of the leadership team and an integral part of hospital management, not just unit management. And they are on the cutting edge of trying to figure out where do the educational needs, or what are the educational needs of the staff that work within the organizations. This week's discussion question, we talk a little bit about how those needs are determined. And so each of you is going to identify 3 states or look up 3 states and look at what the continuing education requirements are. A lot of nurses are surprised to find out that there is no real standard set of continuing educational requirements across the United States. Some nurses are required to get their own CEUs and report that to the state in order to be licensed. That's the case in California, where I primarily practice, but that's not universal. In many states, it is the requirement of the hospitals to identify the needs for education and then keep a track of the education that they're providing and use that as part of their licensing requirements. In other words, the onus of the licensure or the onus of continuing education is not on the nurse and his or her licensure, but rather on the hospital organization. And it's then becomes part of their licensure requirements. And there's arguments both for and against this. I think probably most students, and it'll probably come up in the discussion this week, why don't we have a standard set of requirements? And certainly it seems that nurses should be the ones that are best able to determine what their educational needs are. But the other side of that argument is that how does a nurse know really what their educational needs are unless they're being assessed? And so these hospitals that are required to provide this education and continuing knowledge base building for nurses, they're required to do assessments and identify really where the learning needs are and tailor those learning needs to the hospitals. And so understanding what the requirements are for the states where you're going to be working in or practicing in, that's really important. And so that's really going to be the focus of the conversation this week. So this week, that's primarily what we have on task. just the one discussion question. Please be looking ahead in the schedule because you do have some written assignments coming up later on. I will talk about those as we go through week by week. For now, I look forward to participating with you in the discussions. I will be grading your discussion questions from week number one. The grade should be up probably, I'm guessing, by Wednesday. I'm going to try to have them today. I'm actually recording this on Tuesday, and I hope to have them uh, uploaded by Wednesday. Um, and although sometimes if I do get delayed, it may be later in the week, but I really think that grading the discussion questions should not take that terribly long. So as always, if you have any questions, feel free to go ahead and answer them. I look forward to participating along the discussion with you, posing some new questions, offering some insights and feedback as needed, and we'll see you in the discussion forums.